Here we go again, that time of the year, and the private medical funds are arguing for a large increase. This time, instead of the usual 5 or 6%, they're talking about 7 or even 8%.
Very significant rise for people who are already facing significant pressure on their budget. Now, we had that whole debate last week about GPs and co-payments and about Medicare, but the real blowout in medical costs is in the area of hospitals and hospital care. The GP issue, well, that's about primary care, which is about trying to stop people going into hospitals. This is where we ought to be focusing. And the truth is that the private health funds, they're 30% subsidised by the taxpayer. They get that subsidy there. There's a question really about why it costs so much. And I don't think we ask often enough why it costs so much. We talk about the ballooning costs of treatment in hospitals, the ballooning costs of various services that are becoming more sophisticated. But do we ever ask the question, well, why are those costs ballooning?
Because we kind of know the answer, don't we? Because if you go to your local specialist, all you need to do is look in the car park. You can see what car he's been driving. You know that he's just got back from a very expensive skiing holiday, or he may have spent the summer at his holiday house up on the coast.
Look, the argument is these people are highly qualified. They are people who have studied for years to get to the position they are, and they deal with life and death. But, as you say, very, very highly paid. They charge huge amounts, and they're obviously charging well above what they'd be charging just to recoup their costs and make a bit on top. So there's no real market pressure on them. You've got the public subsidising private health cover. There's no real market pressures coming in. We're not talking about market forces here. So might it be possible for the health funds and for the government to say, look, actually, everyone's tightening their belts. Could you go a couple of years without increasing your charges, and we can keep health fund costs where they are, get them to plateau, or even keep them down in real terms? Is that not something we could be asking or looking at?
Well, we can ask, but do you really think they're going to cut that month in Aspen back to 3 weeks or 2? I don't think so.
No, neither do I.